It's the epidemic coming before the pandemic, the opioid crisis, now taking a turn for the worse.
They're using anything from marijuana to heroin, and nowadays it's not even heroin anymore. It's fentanyl.
Brittany Richards struggled with addiction for 10 years. Now she spends her time saving young people also battling the disease.
I didn't really know what was going on, and I was struggling, and this was something that made me feel better.
Until one day, it almost killed her.
I stopped because I overdosed. I overdosed on fentanyl.
For Brittany, it started with painkillers after a C-section. At just 23 years old, her daughter changed her world, but so did drugs.
I just couldn't live that life anymore. After that, I didn't want to risk dying, for my child, and then I also was afraid of it.
That fear felt by the most seasoned members of law enforcement.
There's no geographic boundary, and nor is there an age boundary.
Right.
Like it's abundantly available, and it's very, very dangerous.
David Lanzoni has worked for the DEA for 22 years. He's now seeing fentanyl take over Connecticut.
Fentanyl is a synthetic opioid that is upwards of 50 times more potent than that of heroin.
A drug so deadly, only 2 milligrams could kill you. Problem is, it's getting stronger and more unrecognizable, masked as other drugs on the streets, like Percocets or OxyContin.
Oftentimes found in places like China, ultimately shipped to places like Mexico, where in turn they are transformed into the fentanyl in these clandestine laboratories. But they're fake, right? And they're counterfeit, and they're being produced unregulated. So you don't know what the dosage level is in any of those. The drug dealers, the cartels are trying to trick the end user.
When it's sold on the streets, fentanyl can come in many different forms, whether it's powder or pills, but both are equally as addictive and deadly.
At the street level, you're going to see them in these small white wax sleeves. Your average bag of fentanyl, the powder substance that's in there, only about 2% of it on average is actual fentanyl. The rest is like a filler.
But police recently found bags of fentanyl with a 58% potency level. Those were found on a 13-year-old who overdosed in a Hartford school and later died.
Fentanyl is a huge problem right now for Connecticut and for other areas of the nation. Every year we have seen an increase of the percentage of deaths that involve fentanyl.
Since 2015, 5,293 people have died from fentanyl overdoses in Connecticut. But when it took the life of a teen, the eyes of many are now wide open to the problem.
We're losing our kids.
Not that I would condone or suggest that experimentation is good at any time, but it's even more dangerous now than it ever has been, because you just don't know.
A deadly drug getting more prevalent and potent. Julia LeBlanc, Fox 61 News.
Or someone you know is struggling with addiction, there is help available. The Connecticut Department of Mental Health and Addiction Services has opened a hotline that is available 24 hours a day, 7 days a week, 365 days a year. That phone number is on your screen right now, 1-800-563-4086.